Hi, ako nga pala si Jackson Campos na mag-order sa World Asthma. Kung may mga asthma dyan, just play your game and just don't forget to get your
Struggling with asthma but looking to get into sports or exercise? I say go for it. My name is Dr. AJ. I'm a national team beach volleyball player and a strength and conditioning and fitness coach. In this video, I'll show you some key tips on how you can engage into sports or exercise even if you have asthma. Firstly, to all the asthmatic patients eager to start getting into sports or exercise, I say it's definitely possible. Exercise can help improve your asthma and your lung function. The key, though, is to start slow and find a plan that specifically suits your needs. Engaging in regular sports or exercise can significantly benefit asthma control. It enhances your overall lung capacity and decreases the frequency of attacks, helping you breathe better day to day. The best activity for asthmatics often include exercises or activities that involve low to moderate rhythmic breathing, like swimming, cycling, or even running. But that doesn't mean you can engage into other more intensive sports like racket sports or volley sports like my sport, volleyball. It's just about having the proper conditioning to be able to help you breathe when it gets intense. That is why it is also very important to be in coordination with your doctor and your coach to determine which kind of activity is suited for your condition. Depending on the demands of the sport or the activity, you can start slowly training, gradually increasing the intensity as long as it is tolerable for you and not triggering any asthma attack. As you engage in these activities, always be on the lookout or watch out for asthma exacerbation signs such as wheezing or prolonged shortness of breath. It's also vital to know that aerobic exercise and even some anaerobic power exercises can definitely help with your cardiovascular health by strengthening your heart and improving circulation. All in all, there are ways to be able to engage in sports and fitness exercises even if you have asthma. It's all about proper planning and proper conditioning. So you start slow, then you gradually progress as long as it's tolerable for you. Thank you to the Asthma Council of the Philippine College of Chest Physicians for giving me this opportunity to share my insights coming from a doctor, national team athlete, and a strength and conditioning coach on how to engage into exercise and sports even if you have asthma. Remember, your health journey is unique and you're not alone with this. You have doctors and coaches at your disposal even if you have asthma. Stay safe and keep moving.
Nice one.
That's better. That's much better. That's much better. Yeah, right? We go. The ball, huwag mo siya tigasan. So yung
morning, I'm Dr. Via Rosales, and today we're going to interview an asthmatic who's also a tri-athlete, Dr. Minnie San Juan.
Hi, Doc Vera.
Hi, Minnie. So, introduce yourself to our viewers.
Hi, my name is Mimi. I'm a physician, but I'm also a tri-athlete. I've been asthmatic since I'm 16 years old, and I wanted to become an Ironman. So, I decided to really do my best and work out, but I didn't let my asthma become my, like a roadblock. So, in order to train, I did my best to become more, compliant with my medicines. And there, I've done a lot of stuff, triathlon, marathon, duathlons.
So, Minnie, tell us more about your asthma exacerbations before.
Okay, my asthma exacerbations before, Doc, they were really, really bad. Like, I think I'm coughing the whole year. And then whenever I do my rounds, I would get shooed out of the room because I'm coughing at everybody. So at one point, I would get to the hospital when the exacerbations are so bad, and then I need like injectable steroids, and then it'll get controlled for a bit. And then I think the most important is getting to the root of the exacerbation. And for me, when I was in third year residency, that's when we found out that the severe bouts of allergic rhinitis, they were the ones that really, really exacerbated my asthma. So, after kasi ng residency, nag-pandemic na, di ba? So, dun, because, we were always wearing masks, I really didn't have a lot of asthma exacerbations during COVID. And then, that's when I knew, if I don't have bad post-nasal drip, and if I do my puffs regularly, I wouldn't have exacerbations of asthma.
So, how do you deal with asthma and doing exercise na ako sa tri-athlete?
Okay, so the very first thing that I always need to do is awareness of my symptoms. So I know when I'm having the sniffles already, and then after a few days, if the post-nasal drip gets out of hand, I'm going to start having shortness of breath. So I'm shortness of breath, like short of breath when talking, when walking, the ordinary things. And then I'd notice, when I do my workout, my pace is slower or my heart rate goes up faster because I'm short of breath. So when I'm aware that like my symptoms are coming back, or I feel like I'm having shortness of breath, that's really my asthma symptom. That's when I start coughing.
What's your final messages to our asthmatics who want to do exercise training?
Or asthmatics who want to be athletes? Well, it's possible. Like, there are plenty of people who suffer from heart attacks and finish Ironmans. There are also plenty of asthmatics who finish Ironmans. And I was really always sickly before. Like, I cannot do my duties properly because I was always having asthma exacerbations. Having the correct awareness about like your symptoms and making sure that you are using your inhaler, getting your checkups, making sure that you use the inhaler properly, and getting a good knowledge of your illness, especially asthma, can help you become successful in your goal to becoming an athlete. Like, you can do everything, swim, bike, run without a problem. Of course, don't forget your inhalers when you're like racing.
So, thank you for inspiring our asthmatics to be athletes also, Doc Minnie.
Yes, Doc. You can do it, everyone!
Hi, I'm Felice Tanco, a practicing pulmonologist here in Manila. So, how do we manage patients with asthma who want to start their fitness journey? I would like to stress 3 points. First, a patient with asthma should have a well-controlled asthma symptoms. So, what are the criteria? Well, we have 4. The first is the patient should not have any day symptoms of asthma of more than twice per week. Second is that the patient should not have any night weakening due to asthma symptoms. Third, the patient should not have the need of any reliever medications of more than twice per week. And lastly, the patient should not have any limitation of activities due to asthma symptoms. So if the patient satisfies all these 4 criteria, and then give him a go-ahead, a green light, he can start exercising. The second point is advise the patient to visit the area, the gym wherein he plans to do the exercise, and advise him to identify possible triggers for his symptoms, and then advise them to avoid those triggers. And lastly, an internist or a pulmonologist should develop a personalized asthma action plan for any asthma patients. Advise them or guide them on how to use the asthma action plan, and remind them to have their medications with them when they start their fitness journey or when they do their exercise. So there are the 3 points.
Hi, I'm Camilo Roa Jr., a pulmonologist and also a physiologist, and also an asthmatic. So, the question, can asthmatics exercise? Obviously, we need people to exert effort to exercise, and if asthma is hampering that, we just have to control the asthma. And then they can exercise, and some people, asthmatics, they can even win the Olympics with proper like medication and underlying control. The reason why asthmatics may tend to avoid exercise is because it makes their asthma more symptomatic. As I was alluding to earlier, exercise is necessary, and exercise happens if the asthma is not controlled. So, what we do is to make sure the airways are not so reactive that when they, for example, inhale the cold air with exercise, particularly if they're already breathing fast and cold air is dry and you have drying of the inside of the lung, and that can trigger asthma. Okay, we have to make sure that their reaction to that, their hyper responsiveness, will be controlled with prior medication. Some medications are on the maintenance basis, and some are just given before the exercise so that they can exercise. And that can actually make them undergo the exercise. As I said, some of them can win the Olympics. When asthmatics develop symptoms, they have cough, they have phlegm, and they have hard breathing, and sometimes chest discomfort, tightness. Well, even normal people can have some consciousness of their breathing with high level of exercise. But there's a big difference between that and that of the asthmatic. In the normal exercising person, when they exercise already higher level, they feel something, but this something is not associated with coughing. This hard breathing actually dissipates when the exercise effort goes down, or they are scaling down, or they're about to stop. It quickly dissipates. Among asthmatics, however, even if they don't do anything, the hard breathing persists as long as their asthma is not controlled, and they are really coughing and putting out sticky phlegm, which is not seen in just regular exercise. When exercising, the asthmatic should be well controlled so that they will not feel the symptoms. So I mentioned already the mechanism. If the asthmatic is not controlled, the airways are so reactive. When the cold air comes in, they react so much. But if they are well controlled, they can tolerate that one. They can do the exercise without having the hard breathing, the undue hard breathing, the coughing, and the phlegm. So, with proper medication, like if they are asked to take a maintenance therapy twice a day, then they maintain that. If they are asked also that in addition they can puff an inhaler, bronchodilator, they can also do that. So there are a lot of ways that can be done effectively to prevent the exercise from triggering their asthma. Again, also, they have to like exercise, for example, when it's cold outside, the weather is cold and the air is drier. Maybe that's more of a problem than when it's regular exercise, like the weather is not so cold, or they're actually in the swimming pool doing the exercise and the air is humidified with the surface water. then they can actually tolerate the exercise. My colleagues here in PCP, I welcome you. Join us in the booth. We will discuss asthmatics and exercise. May 7, as you know, is World Asthma Day. And here we will present you with some options that you can actually share with your patients. When they ask you something about the asthma, about exercise, then you have the ready answer. And with me are other colleagues in the chest physicians group that can provide you some of these tips. Join us.